Joining us, welcome to the agenda. Just take us through what's happening where you are.
Thank you very much, Simpiwe. We are in Pietermaritzburg, where the vaccination of teachers and support staff is continuing in the province. But we'll have to understand that during the first time when the rollout was started in KwaZulu-Natal, the province also had some problems where about 3 or 4 districts ran out of the vaccine. But next to me is the MEC for Education KwaZulu-Natal, Kwazi Mshengu, who will briefly tell us about the updates in relation to how many staff members they've managed to vaccine so far. Thank you very much, sir, for your time. Briefly about the update in relation to the districts that had problems during that time.
Well, there were 3 districts that at some stage ran out of doses, but we have since received additional doses from the National Department of Health. So even those 3 districts are now proceeding normally like other districts. So there is no shortage anymore of the doses as it was the case before. In terms of the numbers, we are quite satisfied with the number of teachers as well as support staff that were vaccinated. As at yesterday, the stats were standing at about 97,000 teachers and support staff that have been vaccinated, and the target is 127,000.
All right, that was Education MEC in the KwaZulu-Natal province, Mr. Kwazi Mshengu, which is speaking to my colleague Mlondi Radebe with regards to the vaccination of teachers there. We've since re-established the line and we cross back to Mlondi.
Educators that, particularly the SGP paid educators and those from independent schools who are still not appearing on the system, the vaccination system of the Department of Health, and we're working to correct those challenges. But we are expecting that will not be far from the target number by the end of the program itself.
Okay. When is the program ending?
Well, initially it was scheduled for 10 days, which is ending this coming Friday. But we're in engagements with the National Minister and the Department of Health to say probably they will request an extension of 2 to 3 days so that we mop up properly the entire vaccination program. Our standpoint from the Department of Education is that we want when we open our schools, we want everybody to have been vaccinated so that we don't have a situation where our schools or the learning and teaching time is disrupted because some educators still have to go for vaccination. That is why we want to vaccinate all those who want to be vaccinated during this period so that when we open, we simply focus on teaching and learning.
The other problem that the province faced was that some members did not want to be vaccinated. What happened to them?
Well, there are those who still don't want to be vaccinated, some because of fear, some they still holding on to the myths that are around the public domain. Some are saying for religious reasons, but it's not a big number of them, and we continue to try and engage them to say there's nothing wrong with the vaccine, there's nothing unreligious about it, there's nothing devilish about it. In fact, it's a safe thing to do, or even though it doesn't protect you from getting the virus, but it helps your immune system basically to successfully fight the virus. So some of the things that they've been raising is that we have heard stories where people who have been vaccinated still contract the virus, and the message is that it has never been said that when you are vaccinated you can no longer contract the virus. The message is that when you are vaccinated, it helps your system to properly fight the virus whenever you get it. So we're still engaging them to say it's a safe thing to do, but also we continue to work hard with the unions and the SGP to continue to really run this particular positive message so that eventually we can get as many many people to be vaccinated so that is not disrupted. I mean, we have lost so much time. We opened late this year. The rotation of grades in attending schools is affecting teaching and learning time for learners. So there are learning gaps that we can now really identify in our learners, and those are the things that we want to close before it becomes too late for us to be able really to deal with such learning gaps.
Also, the other problem was that the number of teachers dying of COVID-19 were also high in the province. What is happening so far now?
Well, although we continue to register the number of deaths and the infections in our schools and as well as the educators in particular, but it's not as high as it was before. You will remember that last year in December, just December alone, we lost about 50 educators just in December alone. But this time around, it's really become less and lesser numbers. Obviously, what happens in schools is a reflection of what happens in society. So as infections rise in our communities, you will see that is reflected in schools. And as deaths rise in communities, that will also be reflected in schools. But currently, it is not really at an alarming rate.
So we're also looking at the young kids. When you are talking about going back to school, there's also those staff members who assist them with food nutrition. What's happening to those members of the school?
They are also being vaccinated. It's just that some of them, again, they don't appear on this electronic database of Department of Health. I had a discussion with the MEC for Health yesterday to say probably we need to look into what they call the manual part of registration. You present yourself, you prove that you are a food handler, and then you get vaccinated. So those are the modalities that we want to explore, so that we don't lose so much time simply because people are not appearing on the electronic system. But I can assure you that all those people who are food handlers, the cleaners and the screeners will also be vaccinated before we reopen our schools.
MEC, I'd like to look at the deep rural areas of KwaZulu-Natal, like Mkanyagut, the Zululand. What's happening there with vaccination? Are they coming forward in their numbers to vaccinate?
In fact, we're also district. They are quite high. People are coming out in numbers. That is why Mkanyagut and it was Mkanyagut amongst the 3 districts that quickly ran out of doses. It was showing the enthusiasm of educators and support staff to go and get vaccinated. So we're not experiencing any difficulties on the basis that these are rural districts, so there's hesitation and stuff like that. So we are quite happy about the turnout that we have experienced in those districts.
The number that you are looking at, it's just less than 30,000 that you left with to vaccinate. Is that a positive result that you've been expecting?
It is indeed a positive result. Given the resistance, not necessarily the resistance, but wrong things that are said about the vaccination in society, you will expect that a number of people probably will be hesitant. But what has worked on our advantage is that educators are also not educators for learners themselves, but for communities. Some have been able to simply distinguish between the myth and the reality. And they chose to stand on the side of the reality, including motivating their colleagues and other people persons in society to say there's nothing wrong with the vaccination. These things have been tested, they are science-driven and things like that. So we're quite really positive about the fact that we'll continue vaccinating more educators and support staff. But the number as it stands, we're quite happy about it.
Thank you very much, sir, for your time. That was the MEC of Education in KwaZulu-Natal Kwazi Mshengu, basically briefing us in relation to the stats that they've managed to vaccinate more than 96,000 teachers and support staff in KwaZulu-Natal, and they are left with less than 30,000 to vaccinate. And back to you in studio, Simpiwe.
All right, Mlondi, thank you so much for that update. That was our reporter, Mlondi Radebe. He just spoke to the MEC for Education in KwaZulu-Natal, Mr. Kwazi Mshengu. This is the agenda.